Hi everyone, David here with Tigner Adventures. Today we are going to be talking about health insurance. Health insurance is one of those things that, we have to decide, are we going to carry it or we're not going to carry it? It's kind of, in my opinion, a necessity. We should all have some option available to us to help us in case some kind of an emergency happens. We have a couple different things available. We're going to kind of discuss those today, give you some ideas of what maybe you can do to help you out as your full-time RVing. We actually purchased our motorhome 6 years today. So we actually took like 2 months to get it all remodeled and everything, and then we went on the road, and we have been on the road now for 6 years. We sold everything. We don't have anything anymore. We have a couple things stored at our son's house in his little closet, but that's about all we have. And so everything other than that is all in this motorhome. And we travel all over the place, so we never know where we're going to be if we get sick. So that's why health insurance can be, something that could be good or bad depending on, the type of plan that you actually get. Those of you that are full-time and you're actually working for an employer, then you have the best of both worlds in that sense, because usually your employer is going to have some type of a health insurance plan, and they're going to put you on that plan, and it's typically going to cover you pretty much anywhere in the United States. So that's the best thing if you're actually working, just to jump on that and you are covered. There is costs involved with it based on your employer, but at least you have coverage in case something is going on and you need help. Now, those of us that are not working, or we don't want to work anymore because we retired, then things change a little bit. So I retired when I was 59, and so I wasn't working anymore. So I didn't have the option of getting insurance through work anymore, and because of that, we actually didn't even carry insurance for the first year because we couldn't figure out what kind of insurance we could get that we could actually afford. There are a couple different plans that are available to you, and things have kind of, over the 6 years now, things have just keeps getting better and better, really. But I'm just going to tell you about a couple different plans that are available to you when you are younger, retired, and not working. Before we go any further, I just wanted to ask if you guys could, if you like what you're hearing here, you can give us a thumbs up. We do appreciate that. And subscribe to our channel. Share our information with your friends and other people. Share it on Facebook. We do appreciate all the help that we can get and support that we get. And now we'll go on to our next topic. So the first thing we're going to talk about is cost sharing, a health share plan. If you look at this website here, it's HealthCare.gov. It actually goes through and talks about a number of the different health shares, gives you a rating on them, tells you a little bit about them, what the costs are and things like that. But basically, the way a health share works is that you're paying an amount of money into a pot, and everybody is sharing in that pot. Some of them will have a network and some won't. And if you're not in network, you do have to pay out of pocket. And then you can submit for reimbursement, and that's how that kind of works. So kind of like a regular insurance company, but it's just a bunch of individuals getting together and saying, you know what, we're just going to help each other out. So I think the two popular ones I've heard from a lot of different friends have told me when they were telling me about Health Share was Liberty Health Share and also Christian Ministry. So those are kind of the two real popular ones. But this Health Share Guide website lists a number of other ones, so you can actually look at those and kind of decide if any of those will actually work for you. And they will determine what your costs are. They'll have a certain cost for an individual, and they have a certain cost for a family. And depending on your health risk, those costs will go up. So that's how health share plans work, is basically you're just sharing the expenses between a lot of people. So many hands make light work, and that's kind of the idea behind the health share option. Now another option is Galileo Health, and that's GalileoHealth.com. You can join their organization. They're a nationwide group of doctors, and the way that works is that you pay a certain fee, and for so many months or for a year, and you have access to a doctor no matter what state that you're traveling in. And so in that case, all that's available to you is just doctor care. But if you just want to get prescriptions, for example, or you have one simple little thing that you just want to talk to somebody about and find out, what's happening, then that system there is something available for you, that you can actually get that help from doctors and things without actually going to the doctor's office. And that may actually even be something you want to use in conjunction with your health share, because when you're on the road traveling around, your health share may be limited on what you can go to. They may cover emergencies, but they don't cover, planned visits to some place and things like that. And that's where this Galileo Health comes into play, is that they will actually, help you out with, no matter where you're at. So if you're in another state and your prescription's running low, you can call them up. They'll get a doctor that's actually licensed in that particular state that can actually refill your prescriptions. Now, the next one available to anybody that is under 65 is a program that's run by the government called HealthCare.gov. Now, open enrollment starts November 1st, and I think it's been extended, now it goes clear up into January 15th. So that whole time frame is what they call open enrollment, which means that you can jump in there and check it out and find out what healthcare options are available to you through their plan. If it's outside of that and you decide that you want to change something in your plan and things like that, you can't. You can only make changes at that time of the year. However, if you have a life-changing event, then you can make changes anytime during the year. Life-changing events. I've quit working. I've retired. That's a life-changing event. I've moved to another state. Life-changing event. I lost my job, or I had certain income, or now I have income. I didn't plan on this income, but now I have income. Now I've got to go in there and claim that. So, life-changing events, you can fill the information out and basically, petition to, get insurance outside of that time period. And because of life-changing events, they'll look at those things and then, if it's things like losing a job or moving to another state, they're going to automatically, allow that. But some things, they may have to get approved. But, those are life-changing events. That's something that you can do. Now, there are some really nice things about HealthCare.gov. One of them is, when you are filling out all your personal information, it's based on the household income. So everybody in your household, you're going to put down what the income is. And then once you figure out what that income is for next year, and you're just basically estimating it, okay? So you're going to estimate what next year is, and then that's what they're going to figure your insurance costs on. Now, one of the options it does give you is that once you've estimated all that, it gives you the option to check to see if there's any kind of like rebates, options available to you to help pay for that insurance. Now, it depends a lot on your income, and if you're single, you don't get as much of a subsidized, portion there, but, it's something that's available to everybody. And so if you actually sign up through HealthCare.gov, the first thing you definitely want to do once you figure out all your income basis is, what kind of a subsidization can I get? When you qualify based on whatever income you've put in there, they're going to say that we are going to give you so much money. It may be, $30,000 towards your health insurance this year. And we're going to do that based on this much per month. So whatever that divides out for 12 months. Now, if your income stays at that level, so next year when you fill out your taxes and the amount of money you made was at that level, if you used all of that, help over here, then you're okay. But if you used all that help over here and your income was up here, then all of a sudden this help diminishes. And so then you have to pay back a portion of that because you did not estimate well. All right, so you didn't estimate high enough. And so what happens is, when you're doing it, the better way to do it is to estimate where you're going to be. They're going to give you this amount of assistance, and you say, okay, well, I have this much available to me, but I'm only going to use this much. So take some off that and pay a little bit per month if you need to. And that way, at the end of the year, if you made this amount, then what's going to happen is when you file your taxes, whatever the difference was here, they're going to give all that to you anyway. You're going to get it no matter what. But if this happens to be a little higher and the assistance went down, then hopefully you're still covered because it didn't go low enough to lower than what you kind of started taking. Kind of just be careful with that piece of it, and it talks through that when you're actually applying for the service and everything. It tells you that and helps you try to determine exactly how much of that you're going to take. HealthCare.gov is a state-based system, meaning that your doctors are going to be in some kind of state in the area that you're going to be living at or your address is at. So you got to be careful which plan that you're picking within there, and you need to understand that limitation that you can't just go anywhere. It does cover you if you have an emergency somewhere, so if you get in an accident in another state, they cover you, and at least you're covered in the hospital. That's all covered and everything. But then if you have other follow-ups and things, then you have to go back to your state that you have your insurance in. And we're going to talk about an option that's available to you to do that same thing too. Kind of how we handle things to make sure that we're covered. We'll talk about that a little bit more later. When you're going to go full-time RVing, one of the things that we heard a lot about is, oh, you want to take out your residency in South Dakota. It's cheaper in South Dakota. Take your residency out in South Dakota. There's actually about 5 states, and we do have a video on that, and a lot of people do, about different states that work best, where you don't have to pay any tax. South Dakota's portion of HealthCare.gov has only 2 providers, and one of those providers doesn't take care of you if you are not physically living in South Dakota. So they do not cover RV'ers at all. There's only one plan that covers RV'ers. So you need to be aware of that with your state, what those limitations are. We've actually since then moved our residency to Arizona, where pretty much everything's been half the cost of what it was in South Dakota. And the health insurance options in Arizona, there's like 6 to 10 different insurance companies. So we picked out one that worked very nice for us, and it gives us 4 free visits a year. And then, once we do meet our deductible, which is based on your income, of course, it's covered 100%. The last thing I want to talk to you about is just Medicare. So those of you that, if you're on HealthCare.gov and you become Medicare age, which is 65, then they automatically move you to Medicare. So you don't even have to worry about that part. You automatically go to Medicare. But there are some things that when you become 65 years old and you're going to go on Medicare that you need to understand. The first thing is that Medicare is made up of a number of different layers, and basically they call them parts. So Part A and Part B are the most common ones that you're going to hear a lot about. Part A is for hospital and things like that, and you automatically have that. It doesn't cost you a dime. There is a deductible for that, and it keeps going up every year or fluctuates every year. And then there's Part B, which covers all your doctors and things, and that's got a deductible also. So based on those 2 different ones, and then you're going to go with, then you have to have something that's a prescription drug plan part that you have to sign up for too. So those are mainly 3 different ones. Now, the best thing to do is to talk to a Medicare professional, somebody that you can actually trust. And that's the hard part right there, is finding somebody that you can trust. So I'm going to give you some things that you should know that you can talk to with your Medicare professional. If they don't know these things or aren't willing to share them with you, then that's probably an indication that that's not necessarily the one you want to talk to. There's a lot of insurance providers out there that do Medicare and can help you and give you good information. You just have to look for it sometimes. So the first thing you should understand, and some of this is just, I've been talking to my individual and I asked him, I says, so do you get more for a certain plan, than another plan? Like if you get me insurance through this insurance company, do you get more of a kickback than this? And she said, no, you get the same amount between. It's not, it's not for them to try to sell you something, upsell you something because they're going to get more money for it. That's not an issue that we really have to worry about. In our case, all we're trying to worry about is what's the best thing available to us. One of them that's really pushed a lot is Advantage plans. Now, an Advantage plan is probably like what you had when you had insurance through your employer. They had some kind of a PPO or HMO or something like that, where you had to go to certain doctors or to a certain hospital, and if you didn't, then they were in network or out of network costs and everything. Okay, that's an Advantage plan. It's the same way, and in a lot of cases, you can get an Advantage plan for pretty much nothing that goes along with your B. So A and B are a set thing. You're going to get billed that no matter what. All right, but because of all the deductibles that you have within these plans available to you, then you can get something that helps pay for those things. And that's where this Advantage plan, and then there's an actual supplement plan. So Advantage plans are where you're in network. Supplement is kind of like an out of network, works anywhere. All right, so an Advantage plan a lot of times doesn't cost you anything, but then you have co-pays and different things like that that you've got to look at. And depending on the type, your health condition and things like that, it may, you have to decide which one of these works best for you. Now, when it comes down to enrolling into Medicare for the very first time, you basically have a get out of jail free card. You get to pick anything you want, and those companies have to take you, period. Okay? That's your very first, when you go into it. You get one time to do that, and that's when you first join Medicare. You get to choose. After that, if you decide, you know what, I really don't like this plan, I want to change to something else, well, now you have to fill out a questionnaire, and then that insurance company determines whether they're going to take you on or not. So it's important that you kind of figure these things out ahead of time. Try to pick the best one you can so that you don't have that problem. The other type of plan that you can get besides an Advantage plan is just a supplemental plan. Now, supplemental plans are based on different, like a plan A, B, C, D, E. I mean, they have all these different plan numbers. Some of them have gone away. If like Plan J used to be there, but Plan J is not anymore. They're always changing. The requirements change. Every year something changes in Medicare, and depending on your age, you may have been in there to begin with, but now those aren't available to somebody else. So you have to look at what's available. You do get a book from Medicare, and the best thing to do is take that book and sit down with your insurance provider and look at what options are best. Now, we're on Plan G, which is kind of the biggest plan that covers everything, pretty much 100%. But Plan G costs the most out of all of them. Plan G does allow us to go everywhere. We're not limited to a network of doctors and things, and so that works for us. One of the advantages I like about a supplemental plan is that you do pay a premium. So say it's $120 a month, then you're paying that $120 and everything is covered 100%, other than the deductible for Part B, which is like $260. So I only pay $260 in a whole year on medical coverage, and I know that my set fee is, say, $120 a month. So to me, in a budgeting purpose, $120 a month is easier to budget for than to budget for going in on an Advantage plan and paying 20% of something. That happens to me, especially if I end up in the hospital. And so that's why I chose the supplemental plan. You have to decide on your own between you and your insurance agent. You guys have to discuss that and figure out what's going to work best for you. If you don't have, if that's not an issue for you, then you want to go with the best plan. They'll figure that out for you. Now, one of the things that you need to understand with Medicare is that each state is a little different on their supplements. The supplements are related to the state that you live in. That's why I went with Plan G, because it can go into any state as I travel around. Not all supplements can do that. Another thing is that each state has their own way of calculating those expenses out. And so there's actually three things that you need to, I can't even get my fingers to do that. Three things that you need to kind of watch when you are looking at different plans. There's three different types. One's a commons-based plan. That's like United Healthcare is commons-based. Commons-based is the fact that they take everybody that's on United Healthcare and say, you know what, our expenses were this high, and because our expenses were so high, we're going to raise everybody's rate this year, this much. Where other companies may be basing it on just what the cost of living change was, not necessarily what they paid out. So that's what commons-based is. The other one is another one they call age-based. So age-based is like, I take out insurance when I'm 65, and this is what my cost is. Now, that cost can keep going up based on cost of living, right? So that may get, but if I'm 85 and this is what I'm paying, and someone comes into this company and they want to buy in a policy and they're at 65, they're paying exactly what I pay. I'm not paying any different than what a 65-year-old was because I'm age-based. And then the next one that's really a tough one, and that's age obtained. So what age obtained is again, all those policies are going up a little bit each year based on cost of living changes. But age obtained is that, I got it at this rate because I was 65. Now I'm 66. Well, my rate's going up because I'm 66, and whatever cost of living is going up. And so slowly they all go up because they're age obtained. So those are the three different things. That's what you got to talk to your insurance agent about, is to understand what those differences are. And then that gives you an idea, when you're figuring that out, what's going to work best for you, whether it's the Advantage plans or some kind of a supplemental plan. But when you are an RV'er traveling all over, you got to be really careful to make sure that whatever you have is going to be in a plan that can cover you in that particular situation. This last summer we traveled around. I ended up in Oregon. I ended up going to emergency there. Didn't pay a dime. Everything I had done this year has been covered 100%, other than my Part B deductible, which is like $265. Nobody on any of the plans today cover that deductible. So you do have to pay that $260, but that's not a bad deal. And so anyway, that was just how that works. So that's something that you need to keep in mind. Now, I was mentioning earlier that, when we're traveling around, all these things that are state-based, you have something happen to you, then what happens, Emergency's covered, but now I'm sitting in another state, I got to get checkups, I got to do whatever, I still got to go to the doctor and everything. Well, all of those things are out of network. And depending on the plan that you have, those may not be covered. The plan that we have, there's no out-of-network at all. We pay 100% of the out-of-network. And that's because we wanted to keep the insurance costs low, and so that's what we end up with. But we have this other service called Skymed, and Skymed is one of those evacuation services. The cool thing about RVing is that you get to choose your home location. And for me, we chose Utah because if something happens to me, then they will fly me to Utah. They'll fly Ninette and they'll fly Tansy to Utah. Eventually they could take our motorhome to Utah. But that's where our kids are. And so, Ninette would have a support system there. Now, if something happened to Ninette, we have Arizona. So we would fly her back to Arizona, and then, she would be able to get the health care she needs, and we wouldn't have that big health care expense and everything. So Skymed is a definite advantage for us, and we're traveling all over as a full-time RV'er. So it's nice to be able to have something available to you so that it can help you out in case that happens, and then you're covered. And the cool thing is that even if I flew to Salt Lake, and then I got better, then they're going to fly us all back to here. And we don't have to, try to get a ride back. But, with Medicare, they evacuate our friends to Phoenix, and now they're ready to come back. They don't pay for them to come back. Someone drives up there and gets them and brings them back. With Skymed would just actually return you back to Yuma again. So that's kind of a cool thing. I'll put some information in the description below if you're interested in that. You can call our friend Todd. He can answer any types of questions with that and see if you're interested in that. So 'tis the season for health insurance. Everything's open enrollment right now. So hopefully this has been, I've given you different things to think about. I am not pushing any particular type of insurance. I'm just trying to give you some things that you need to be aware of. And then you can go talk to a healthcare provider and figure out what's best for you. And as a full-time RV'er, there's just things that we need to be aware of that's a little different than other situations. And your insurance person may not know that, and so that's things that you want to bring up to them. And now some things about those situations, different types of policies, that hopefully that'll help you in figuring out which one's going to be the best for you. Because the biggest thing is that you want to have peace of mind as you're traveling around, and you don't want to be stressed over, different things that happen, So at least this gives you a few different options. So thanks for watching. Thanks for following us. Hopefully we'll see you down the road somewhere, and if not, then we'll just see you on our next video. But you guys take care and be safe out there.